الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. The Concept of Health and Health Indices by Professor Mahmoud Hani Sulaiman. Introduction. In this introduction, we will try to define health and have a look at different phases of this health. Health, as defined by WHO, it is a state of complete physical, mental, and social well-being of an individual, and not merely absence of disease or infirmity. Health is not an end, but road to live socially and economically a productive life. As per definition, health is with three dimensions: physical, mental, and social. Non-medical dimensions which can be included are spiritual, emotional, vocational, political dimensions. Physical dimension of health. A person is said to be physically healthy when all organs and systems in body are functioning perfectly at their optimum capacity. Signs of physical health are good complexion, clean skin, bright eyes, what you are looking at during physical examination, good will built, good appetite, sound sleep, regular activity of bowel, bladder, and coordinated body movements. All special senses are intact. Resting temperature, pulse rate, respiratory rate, and blood pressure are all in normal range for age and sex. Physical health of an individual assessed by history of treatment or hospitalization through clinical examination, anthropometric measurements, biochemical and lab investigations. Mental dimension. A person is mentally healthy if he is having perfect state of balance with surroundings, harmonious relation with others, intelligence, memory, learning capacity, not having any major internal conflicts, accepts criticism, got good self-control emotionally, has self-confidence, he is cheerful and calm. The mental health of an individual assessed by his behavior and attitude. Social dimension. An individual is socially healthy when he is accepted, respected, loved by family, friends, relatives, neighbors, colleagues, and others. So, he is accepted, respected, and loved by family, friends, relatives, neighbors, colleagues, and others. A spiritual dimension. This is a holistic dimension. A person is spiritually healthy when he possesses sound mind in a sound body. Sound mind in a sound body, leading a simple life with a high level of thinking. Thus, spiritual is something which transcends physiology and psychology. Emotional dimension. This is difficult to differentiate from mental health. Person is emotionally healthy when he does not lose temper or does not develop tension and has self-control. Vocational dimension. An individual is healthy vocationally when he is capable of earning sufficiently to lead the life successfully. Positive health. A person who is healthy physically, mentally, and socially is in a state of a positive health, thus enjoying human right, productive life, part of development, quality of life, worldwide social goal. He is enjoying human right, productive life, part of development, and quality of life, the life of good quality. A spectrum of health. Health of individual is a dynamic process. At any given point of time, it changes in a range of spectrum varying from highest point of positive health to the lowest point of death, as seen in the figure. He is beginning from positive health here, then better health, free from sickness, apparently normally, unrecognized sickness, mild sickness, moderate to severe sickness, then death. Transition of health from one level to the other is so gradual that it is very difficult to say when one level ends and the other level begins. It is only in acute cases, under exceptional conditions, there is a sudden decline from one part to the other. Determinants of health, factors which determine health: inside body, outside body, promote or deteriorate, multifactorial. Some are inside body as genetic intrinsic factors. Some outside body environmental factors. Interaction of these factors may either promote or deteriorate. Thus, health is a multifactorial phenomenon. The important determinants are genetic or biological factors. Health is determined by genetic constitution that takes place at time of conception. Once genes takes place, it is permanent and it cannot be altered. This is till now. They are trying to make genetic treatment. If constitution of genes is defective, it will lead to certain diseases transmitted by heredity as sickle cell anemia, phenylketonuria, mental retardation. Carrying genes from parents is called genotype, and its external manifestation is called phenotype. There is no treatment for genetic diseases. However, it can be prevented to some extent by genetic counseling to potential couples before marriage. Environmental factors. Internal environment constituted by various organs and systems of body. Their harmonious functioning is called homeostasis. External macro environment made up of physical, biological, and social environments. Physical, biological, and social environment. Any disturbance in internal or external environment disturbs health. Health is a state of dynamic equilibrium between humans and environment. Lifestyle or way of living. This denotes health behavior of persons. It includes cultural patterns, social values, behavior of habits, e.g., smoking, alcoholism, multiple sexual partners. Many diseases associated with certain lifestyles, e.g., AIDS, coronary heart disease, obesity, lung cancer. So persons with these risk factors considered at-risk groups or having a risky behavior. These lifestyles developed by process of socialization and social interaction with parents, friends, peer groups, etc. The figure is next slide. However, not all lifestyle factors are harmful. There are many lifestyles that promote health. For example, adequate nutrition, physical exercise, meditation, and enough sleep. Here, the lifestyle makes the difference. The lifestyle interact with every factor, with environmental pollution, malnutrition, population, mental health problems, RCH, cancer, diabetes, cardiovascular diseases, and AIDS. Here is main determinants of health. Non-modified determinants as age, gender, genetic makeup, and ethnicity. Not modifiable determinants of health. Lifestyle factors as diet, physical activity, substance use as alcohol, tobacco, drugs, sexual behavior. Wider environmental factors, education, employment, housing, transport, environmental conditions, access to water, food and healthcare services. All these together makes interaction with the human. Socioeconomic conditions. The important socioeconomic factors influencing health are education, occupation, and income of individual. Education. It is observed that illiteracy is associated with increased morbidity and mortality. Especially female literacy level is very important. To some extent, literacy compensates the effects of poverty on health. Occupation. It is also observed that morbidity and mortality is more among unemployed than employed persons. Unemployment problem itself causes psychological and social damage. On the other hand, there are many occupations which affect health of workers in industry. They are discussed under occupational diseases. Income. This is the most important key factor which determines standard of living, quality of life, and so health status of individual and community at large. Diseases of poor socioeconomic status are mainly malnutrition, tuberculosis, leprosy, gastroenteritis, swarm infestation, etc. And diseases of affluent society are obesity, hypertension, coronary artery disease, diabetes. So illiteracy, unemployment, poverty associated with increased morbidity and mortality. Health services. Availability of healthcare services as immunization, family welfare, nutritional services, educational, etc. not only prevent disease but also promote health and prolongs life, which leading to social and economic development. Aging of population, even though health services prolong life of people, aging itself is leading to chronic disease, increase of chronic disease, disability accompany the aging process. Health indices. These are guidelines which indicate health status of a place, e.g. country, city, population, sector of group, or group of countries. Uses. To measure, to compare, to assess, to plan, to evaluate. To measure health status of a country, to compare health status of one country with another one, to assess healthcare needs, to plan and implement healthcare services, to evaluate healthcare services. Since health is multidimensional, it is measured by many indices and indirectly. These indicators are as follows: mortality, morbidity, disability, nutritional, healthcare delivery, utilization, social and mental, socioeconomic, health policy, environmental, quality of life, and other. These indices are mortality indicators, morbidity indicators, disability rates, nutritional indicators, healthcare delivery indicators, utilization indicators or rates, social and mental health indicators, socioeconomic indicators, health policy indicators, environmental indicators, quality of life indicators, and other indicators. Again, mortality, morbidity, disability, nutritional, healthcare delivery, utilization, social and mental, socioeconomic, health policy, environmental, quality of life, and others. Mortality indicators. Crude death rate equal number of deaths per 1,000 population per year in a given area. It indicates rate at which people are dying. Higher the crude death rate, poorer is the health status of a country. A decrease in crude death rate indicates overall improvement in health of population. After all, decrease of death rate is the goal of health care. It is considered to be of less significance for international comparison because of differing age-sex composition. In 2020, CDR for Egypt was 5.75 deaths per 1,000 population. CDR of Egypt fell gradually from 15.7 deaths per 1,000 population in 1971. Infant mortality rate, IMR. Equal number of deaths of infants per 1,000 live births during given year in a given population per country. It is a very comprehensive indicator, sensitive indicator, and the most important indicator of health, infant mortality rate, because it reflects quality of MCH services and availability and utilization of these services. It also indicates socioeconomic conditions under which infants live. Thus, IMR is universally accepted indicator of health status. In 2019, infant mortality rate in Egypt was about 17.3 deaths per 1,000 live births. 17.3 deaths per 1,000 live births. This figure shows infant mortality rate from 2009 to 2019 per 1,000 live births in Egypt. As you see, it is decreasing gradually from 25 to 17. This figure illustrates perinatal, neonatal, and infant mortality rate, what it measures. From the week 28 weeks gestation to the 7th day after birth, this is called perinatal mortality. From birth till 20 days, it is neonatal mortality. This is total neonatal mortality. It is subdivided into early neonatal mortality from birth till the 7th day and late neonatal mortality from 7 days age to 28 days age. From birth till end of 1 year, it is called infant mortality. Again, infant mortality from birth to end of 1 year. Neonatal mortality from birth to 28 days of age. This is total neonatal mortality. It is either early or late. Early in the first 7 days, late in the early in the first 7 days, late in the 3 weeks come after. And perinatal mortality from 28 weeks gestation to end of age of 7 days. This is a very important slide. Maternal mortality rate, MMR. Remember, there is also MMR, measles, mumps, and rubella vaccine. Maternal mortality rate, this is also indicates quality of health services provided to mothers of reproductive age group, i.e. antenatal, natal, and postnatal services. In 2017, maternal mortality ratio for Egypt was 37 deaths per 100,000 live births. 37 deaths per 1,000 live births. This table shows direct causes of maternal deaths from the year 1992 to 2013 in Egypt. As a whole, it decreased from 1992 to 2013. And the main cause of these deaths are postpartum hemorrhage. Then comes hypertensive disease. Then comes sudden death. Postpartum hemorrhage, hypertensive disease, sudden death. Child mortality rate, equal number of deaths of children between 1 to 4 years during given year per 1,000. Mid-year population of that age group divided by mid-year population of this age group. This excludes infant mortality. In 2019, child mortality rate of Egypt was about 20 deaths per 1,000 live births. 20 deaths per 1,000 live births. Between 1970 to 2019, child mortality rate of Egypt declined at moderating rate from 245 deaths per 1,000 to 20 deaths per 1,000 live births in 2019. So from 245 to 20. This is also considered an indicator of health because it is related to nutritional services, immunization services, family welfare services. Under 5 proportional mortality rate, it is percent of total deaths occurring among children under 5 years. It includes both infant mortality and child mortality rates. High rate indicates poor health status. In Egypt, it equals 52. Proportional mortality rate of communicable disease equal percent of total deaths due to communicable diseases. It is an useful indicator because it indicates magnitude of preventable mortality. Morbidity indices. These reveal burden of diseases in a community. Thus, these are used to supplement mortality rates. The following morbidity rates are used for assessing health status: incidence rate, prevalence rate, notification rate, outpatient attendance rate, hospital admission and discharge rate, duration of stay in a hospital. Incidence rate, it is the number of new cases of a particular disease occurring per 1,000 population in a year. New cases of disease occurring per 1,000 population in a given year. Prevalence rate, total number of both old and new cases existing in population during a given period or time. It is expressed in percentage, i.e. percentage of population suffering from a particular disease. Disability rates, it is the percent of population unable to perform routine expected daily activities. Population unable to perform routine expected daily activities due to injury or illness. For example, eating, walking, dressing, going to the toilet, etc. It is used to supplement mortality and morbidity indicators. Disability rates quantifies seriousness of disease. The more the disability, the more the serious is the disease. Disability rates divided into two groups: event type indicators, person type indicators. Event type indicators: number of days restricted activity, bed disability days, work loss days, either school loss days or sickness absenteeism for workers. Person type indicators: limitation of mobility, confined to bed or a house, limitation of daily activities. There is another new index called Sullivan's Index. Disability rates continued. Health adjusted life expectancy, or HALE, health adjusted life expectancy. It is number of years a newborn is expected to live in full health based on current morbidity and mortality. This term HALE was previously known as DALE, DALE, disability adjusted life expectancy. Disability adjusted life year is number of years lost in healthy life of an individual due to disability. Number of years lost from healthy life of an individual disability. Nutritional status indicators, these are incidence of low birth weight, weight and height standards of children up to 5 years. Healthcare delivery indicators, these indicate availability of health manpower resources of the country and thus provision of health care. Utilization rate, it is percent of people actually utilizing health care services in a given population during a given year. For example, percent of infants fully immunized, percent of expectant mothers with adequate antenatal care, percent of deliveries conducted by trained birth attendants, bed occupancy rate in hospitals, coverage with insecticidal spraying. These are utilization rates. Indicators of social and mental health include rates of crimes, assault, murder, theft, suicides, homicides, accidents, juvenile delinquency, prostitution, gambling, drug abuse, lock out of industries. Also add divorce, family violence, battered baby syndrome, battered wife syndrome. These indicators provide guide to implement social action for improving social and mental health of people. Socioeconomic indicators: growth rate, per capita income, gross national product, percent of people below poverty line, percent of unemployment, dependency percent, literacy percent, family size, per capita calorie availability, percentage of overcrowded houses. Health policy indicators: these are the proportion of budget NGP spent on health services and health-related services as water supply, sanitation, nutrition, housing, community development. Environmental indicators: these reflect the quality of physical and biological environment. These include indicators relating to pollution of air, water, noise, radiation, solid waste, etc. Important ones are percent of safe water supply, percent of adequate sanitary facilities. Indicators of quality of life: physical quality of life indicators explained under lifestyle. وأقول الحمد لله و thank you for your good listening.